Traumatic enough going to the hospital, but what happens when the hospital sends you home and you're not quite ready? Well, we have some answers for you today in today's CI Health, and joining me is Carrie Wright, who is the community liaison for Helia Healthcare in Champaign. Thanks for being here, Carrie.
Thanks for coming. Welcome to Helia.
Thank you. We're going to get a little bit of a tour here in a second, but I want to talk specifically with you about what people need to think about, because that time when people have to go home comes up a lot faster than many people think.
Correct. Typically what we're seeing after surgery is a 3-day discharge. People want to go home. Unfortunately, their healthcare needs to continue after the hospital, and so that's where we welcome you to come to Helia Healthcare. I will verify your benefits through insurance to make sure that it's all paid for, and we will provide therapy.
So if you're looking at the things that people need to consider, you definitely need to figure out what's going to work for your physical care. That's high on the list. But also making sure that what you're getting is paid for.
Absolutely.
Because you don't want to
That's usually the biggest concern.
Yeah, you don't want tens of thousands of dollars in bills afterwards.
Absolutely.
And so what is the biggest thing when you're talking with people? What do they want to know? What do you do to reassure them that this is the right choice for them?
I try to give them the big picture of how the discharge is going to happen at the hospital and the entire transition into our nursing center, as far as how the room looks, who the nurses are, what they can expect, the average length of stay, and then all the way up until our dedicated staff, like our social worker, Lauren, that will help with discharge.
Well, and that's really important because at the end of the day, people want to be comfortable. You're recovering from a physical trauma.
Absolutely.
You need to know and have the confidence that you're getting the care that you need in a place that you're going to like.
That's right, and usually people are asking to come back when they go in for their next surgeries.
I love that. All right, let's check in now and learn a little bit more about nursing at Helia. Michelle Hogan is the Director of Nursing at Helia, and you've gotten recognition for your quality of care. Tell me a little bit about that.
Right now, we are the only facility within a 50-mile radius that has 5-star quality measures.
And who measures that?
That's measured by Medicare.
Yeah.
And it includes things like pressure, ulcers, pain, rehospitalizations during your short-term stay.
And because those are all so low, you guys are recognized as one of the top facilities right here in Central
Correct.
Illinois. That's really great. So what else do you tell people when they ask about the nursing care here?
All of our nurses here are our residents are our family in our building, and I always say that we don't work where they live where we work.
Yeah.
So it's very important to us that we treat everybody in our facility like they're our family.
Very much so, and a lot of your family ends up going home, and that's really important. So
Yes.
let's go learn a little bit more about some of the therapy options here. The kitchen setting, very important for a new program here called Arch. And joining me is Beals, who's the director of the program. What does Arch do?
Arch is a bridge program from many places. You might be in the hospital, you might be at home, but you come here just to get back to your baseline. You know, sometimes you get setbacks and illnesses, and then you come here to get a little therapy so you can maybe build up your strength or build up your cognitive skills or your stamina or your balance. There's all different reasons why people come to the Arch.
You have some really skilled people here helping with speech care, with physical therapy, so even using computerized machines that can help to build yourself back up. And then the kitchen, this is a great example of your occupational care.
Absolutely. We have different things for them to demonstrate that they can safely use, and one of the important things is the stove.
Oh yeah, let's look at this. I was going to say it's even as easy as opening the dishwasher, but then the stove is potentially dangerous, so you really need to know how to use this.
We want to make sure that the patients are going home and that they're going to be safe, so that they can operate that in a safe way and demonstrate that for us before going home.
So some people might have a little bit more trouble saying opening the oven or turning something on. It depends on the person, and you guys do a lot of individual care.
Yes, we do individualized care plans for each patient, so everybody has their own needs that they need to work on. So, and sometimes somebody has maybe diabetes, so that they have their own plan on how we're going to help with that and how we're going to treat that. Every patient and illness has their individual care plan here.
And really, really important because you want people to get up and back home.
Absolutely.
Wonderful. Julia, thank you so much.
Thank
we
you.
appreciate it.
Appreciate
Julia Beals with Helia Healthcare in Champaign. So much to see here. They're redoing the whole facility as we speak, and you need to check out the Arch program too. They're willing to give you a tour, and Carrie is waiting for your call. The information is here on your screen, and we'll have more information for you at CILiving.tv.